very good morning and welcome back to your Feel Good Breakfast show Expresso on SABC3. Now, a very newly released study on the prevention of HIV and AIDS shows the remarkable effectiveness of antiretroviral drugs on transmission of the virus. Now, with us on the line to give us details, one of the authors of the study, Professor Ian San, Director of the Clinical HIV Research Unit at the University of the Witwatersrand. Thank you very much for taking our call this morning.
Thank you. Good morning, Kateko.
Now, just tell us a little bit more about this groundbreaking study, and it's the first randomized clinical trial to show how that treatment of HIV-infected individuals with antiretroviral therapy early on in their HIV infection reduces the risk of transmission of the HIV virus to their uninfected partners, right? So just how effective is this prevention method?
So the study, the HB10052 study, was started in 2008, and the interim results in 2011 demonstrated a 96% reduction in HIV transmission. What we're presenting now is the results, the long-term results, some further 4 years later, where the overall result appears to be a 93% reduction in HIV transmission. After the study was interrupted, or results were released in 2011, those participants in the delayed treatment arm were offered treatment and gradually came on to treatment. And so by the end of the term, 98% of the HIV-positive index patients were on treatment. The transmissions that occurred on treatment, half of those occurred. There were 8 in total. Half of those occurred during the induction phase. As the treatment was started, the viral load was coming down gradually. The other half occurred when the index partner had, in fact, the antiretroviral therapy treatment failure. So our recommendation is to protect, use other forms of protection during the first 12 weeks of treatment until the viral load is completely suppressed.
Yeah.
And continuous adherence treatment.
Exactly. And I mean, these are remarkable results that you're talking about in terms of the percentages of success rate. But like you were saying now, that we're not trying to put the wrong message out there, that it is still necessary for partners to exercise those necessary protection measures and to implement them, of course, not have safe sex, or unsafe sex rather, because of course transmission is still a very real thing.
Yes, so we do believe that these are remarkable results, and the durability of these results has been very exciting to us. The question now is whether this adds to the discussion that all HIV-positive people should be on antiretroviral therapy. And the benefits of treatment were also demonstrated to the index patients. So it's not only all about transmission, but the benefits of treatment to the index patients in preventing tuberculosis and opportunistic infections was also demonstrated. And so together with another big study that was released in May, the START study, which showed that very early antiretroviral therapy benefited people with CD4 counts greater than 500, the two results combined really push us to consider a treat-all strategy, the so-called test and treat strategy.
Now, of course, just a last question. Can we expect a change in terms of policy from government side with now these newfound results?
So government is discussing a move. We've already moved to higher CD4 count levels at 500, and we are already providing women who have been provided antiretroviral therapy in pregnancy with lifelong treatments. So now the debate is whether we move to this treat-all strategy, test and treat. It does. There are other facets that need to be addressed. Is how do we identify HIV-positive people? How much HIV testing do we need to do? Then the pharmacy supply chain management, that we can actually have enough volumes of drug. And then linkages to community-based treatment centers, so that perhaps adherence clubs, so that the distribution of drugs is actually undertaken more closer to the patient. If we can address some of the constraints, the total amount of money that needs to be available to treat 5 to 6 million people. If we can address some of those, it certainly is medically and scientifically the correct strategy.
Well, thank you very much for chatting to us this morning, Professor San.
Thank you for your interest.
And that is Professor Ian San, Director of the Clinical HIV Research Unit at the Wits University, of course, giving us details on this newfound research, a remarkable results indeed. But of course, most importantly, it is important for you to get tested. And of course, if you have contracted HIV, to get onto the antiretroviral therapy as soon as possible. Right now, it is time for us to catch up with the early morning headlines, and Zoe has those for us.